This fine gentleman brought his son, his 7-year-old son, to the emergency department because he's really tired and it seems like he's having difficulty breathing, not doing well. He's worried about him. Okay, so whenever you're ready, start.
Okay.
And the patient is here.
Okay, so guys, we've got a 7-year-old child with allergy. We've got the airways Alessia, at the monitor Gaia, and I have the clinical examination, Raffaele Keeper, Federica Drax, and I'm a deputy leader. So the child is here. Alessia, can you evaluate the conscious status?
Yes.
And meanwhile, Gaia can examine.
Does he respond to verbal stimulation? Yes, but if you're not talking to him, he closes his eyes.
Okay. Okay, well, wait, just want to finish the part. How is his body color?
He's a little bit pale, but otherwise no modeling, nothing else like
Do
that.
I hear any sound? How is he breathing?
He's tachypnic, but he's not wheezing. There's no stridor.
Okay, is there a position of comfort?
He seems comfortable for my hands.
Okay. Can you start the duration?
Are he expectant? So if you're asking about secretions, he doesn't have secretions. He doesn't have. Nope. And the tongue and all of that, there's no way. Okay. When he's breathing, I hear some noises that the woman doesn't know. There's no noise. No noises. So I think there's no noises. There are no situations.
How is breathing time?
It's about 5 seconds.
Is there any different sign like negative on the extension?
Yeah, so he has his liver is about 5 centimeters down on the right side, and then he does have some prominent jugular.
Okay, is there any spasm, respiratory spasm?
He's tachypnic, but no retractions.
Yeah, you can take it. Yes.
Okay, and then I think there are different signs hepatomegaly, interest, the distinction, and lateral fractures of the chest. And there is taxonomy.
Okay, so it looks like a septic shock syndrome of it is intensive or not. When you're already tired and your parameters, while you're also clearly able to get the access.
Okay. No, not on the first try.
Okay, how is the circulation? It's 94%, the rate is 55. We are waiting for the pressure. Okay, meanwhile, let's put oxygen for your mask. Meanwhile, release tachycardia and if you're not able, can you take it to the manual one? Yes. Pressure. Yes, thank you, Alessia. So oxygen is on, and I will get the pressure. The salt one is sleeping on so we can to take another access. We need to take an initial access. Okay. And again, why the cardiac is in the middle. I think it's necessary to do an ECG because I saw okay, can you try the vision ECG please? And meanwhile, can you call the cardiologist?
Okay, for the cardiologist because we have done a 12 elevation ECG.
Okay, they'll call you back.
Okay, so we're taking into access.
Okay, you got it.
Okay, and we start a really soft dose, 5 ml in 20 minutes,
Okay.
and we must do for the inotrope because he has already followed the signs. So, can you call the reanimator because
okay.
I think that we must start an adrenaline in continuous infusion because his heart is okay.
Okay.
While we do this, I finish the evaluation.
Okay.
I
call the
Okay, yes, okay. 5 ml of oxygen solution per kilo, so it's 110 ml in 20 minutes.
Okay, and we must then start with the inotrope. So, you try to take another
Yes.
Okay. Can you go?
Is there anyone to talk with? Some parents, mom, never
You can be with that.
Okay.
Meanwhile, he's still conscious.
Okay.
He's okay. He's still like respond to verbal stimulation. Yeah, and he doesn't look easily.
part, but not of the adrenaline input infusion.
Okay.
Let's check. Is there how is Christina?
It's normal.
Okay. How is blood temperature?
87.
How are his pockets?
Normal.
Okay.
Sorry.
Is there anything on his body? Is there anything on his body?
No bruising, no rashes.
Okay. So can we have a fast of
They're on their way.
Okay. Can I even ask for an X-ray?
Just not yet.
Okay.
It's coming.
Meanwhile, let's do the evaluation.
Shall we get this?
Ready?
The pressure is
Okay, we evaluate the salutamo. So just while we're waiting, you can
Ok, allora so che ha avuto febbre 2 settimane fa, fever 2 weeks ago, he got better, but from 3 days he had fever number 1, he's not allergic, he has no pathology, and he preferred the position, say, okay, I don't know.
Okay, maybe it's better since it's got
I tried.
And okay.
You don't have to hold them up. You just say that.
Okay. So can you still keep evaluating the period? I just want to do a recap for Raffaele. A 7-year-old boy with a cardiogenic shock, with the radicular signs. We have done the exams. We have one intraborn line and one E line. We started the bolus of 5 minutes, 20 minutes, and the continued infusion of adrenaline. We asked for X-ray, for an 12-degree and we coded the cardiology, and for echofocus. And we already started the salbutamol in pasta. For CCS got some operation at the HG. We still don't know how is the gas. And we have already prepared the calcium-gluconato and insulin and glucose. Can we do evaluation?
Okay, your blood gas is ready.
Okay.
It's 7 to 8 pH. PCO2 is 36. Base deficit is -5. Sodium is 135. Potassium is 4. And ionized calcium is 1.2.
And potassium?
4.
Okay, so it's not prepared, but that's the evaluation.
Okay, finished. Good job. You're done. And a father has brought in his 7-year-old son, who's very worried about him. He says that he hasn't been feeling well for a couple days now. He's very tired, seems to be uncomfortable and having a hard time breathing.
Solo l'ultima parte.
Having
From a 7-year-old boy.
he's very tired, okay?
Sì.
Poor energy, difficulty breathing.
Ok, allora innanzitutto prepariamo le spalle e mettiamo i occhi, quindi ceci ai tempi, e le valutazioni, monitor, cavaliere e farmaci. Ok, il bambino è già arrivato? Ok, è cosciente o incosciente?
Yeah, if you approach him or touch him, he'll open his eyes, but otherwise they're closed.
Ok, il colorito?
A little pale, but nothing else notable.
Ok, respiro al momento?
His stiff neck, breathing fast.
Ok, e allora mettiamo sul monitoraggio e passiamo con le valutazioni.
Le piede sono ferme.
The hand always are free.
it's clear that
No, I know. I want you to say specifically what are you asking about. No secretions.
Niente in bocca.
nothing in the hand.
You don't see anything in the mouth. Okay.
Andiamo avanti con la valutazione. Allora, stato di tracce, espande bilateralmente.
Bilateral stability.
You should be able to see on the
Ha segni di distress respiratorio. La meccanica respiratoria com'è?
He's breathing fast.
Sono 93, io gli metto un po' di ossigeno.
Ok? Non vediamo rientramenti rientramento delle pinne, rientramenti, alzamento delle pinne nasali.
Can we see something in noise like something
Like this time, no strider, no retractions. Okay.
La saturazione è 95, 35 alti.
Andiamo avanti con le
frequenza
frequenze.
con le ricorsioni.
Sentiamo il polso, ci sarà la percetto.
Io nel frattempo cerco di prendere un accesso. Riesco a prendere un accesso?
Not on the first try.
Ok. La secondo braccio?
Relax fast.
A 80 e 30 di pressione.
Yeah.
A 80 e 30 di pressione.
Ok, il respiro migliore.
Yeah.
Calcolare di pressione.
5 seconds.
5 secondi, ok. Quindi abbiamo preso un accesso, intanto prepariamo ai laterali della quella fisiologica e dopodiché
Conosciamo il peso del bambino?
Below the weight.
Oh, the weight. 20 kilos.
20 kg.
ci si può guardare il passo del papà e
Io posso andare con una mesi col papà. Okay.
we're going to do the next example before the body. So, hemographs with biochemistry and indici di infiammazione, hemogas and the glucose fast glucose compound.
Glucose is normal. Okay. The rest of your labs are pending.
So we're going
How much fluid are you using?
what?
How much fluid are you using?
200 ml in 10 minutes.
In 10 minutes.
Okay.
2 weeks ago?
We're going to check the signs of precardius to the liver. Do we feel the liver? Does it have
So you started the bolus, right? Did you start the bolus?
As
She said she was on it.
now can we feel the liver?
So stimulate on the ball and I'll tell you. So the liver is 5 centimeters now. Yes, 5 centimeters.
5 centimeters.
5 centimeters.
Abbiamo start il bolus.
Okay.
We're gonna do
Adrenalina. Abbiamo 187 di frequenza.
okay, we're going to the analysis.
Sta iniziando a desaturare, 90 di saturazione e 190. Però nella P io la vedo.
Se volete vi faccio i ragazzi. Allora, lui è un ragazzo che sta in un bambino che si è preoccupato qui perché dalla storia che speriamo peggio. La sua storia praticamente del papà e della famiglia hanno avuto un episodio di raffreddore, di febbre, che poi ha avuto anche lui, che poi è migliorata, e che però da 3 giorni lui ha ripreso ad avere difficoltà respiratoria e febbricola. Non aveva preso nessun tipo di medicina a casa, neanche occidentale del papà, non ha altri aspetti particolari, quindi non è stato ricoverato per medici, non ha avuto adesso una carica di peso, insomma, sintomi particolari, e hanno avuto per l'ultima volta ieri sera a cena perché se no non era
Yes, tomorrow he has surgery.
Do you have something from the
Ho una
exam?
situazione di
Relax.
Yeah,
So the blood gas is back. The pH is 7 to 8. PCO2 36.
Okay.
Base deficit -5. Sodium 135.
Okay.
Potassium 4.
Okay.
Ionized calcium 1.2.
Allora, per fare il recap, abbiamo fatto un volo, ma il volo si è
Ok.
Medicina offensiva.
Ok, vogliamo pensare a una cosa da
Quindi tu pensi a una
stato di sodio.
Sorry, can you speak up, please? Just have
Ok, stiamo un attimino ragionando stiamo facendo un attimo il punto su quello che abbiamo davanti. Ok, e quindi facciamo il nitroglicerolo di sodio. Ok,
Accendiamo un eco intanto.
sì. E accendiamo un'ecografia per i FAS.
So you're going to give saline? Or what? A liter of sodium? What is that?
Un litro? Un litro di?
No. Ma poi abbiamo capito cosa gli diamo di farmaco.
Nitrocrossiato di sodio.
Fustiato di sodio.
Nitroprusside.
Yeah.
Okay. Facciamo 10 minuti questo Okay, the echo machine is coming.
Ok,
Yep.
Ok, io sto somministrando il nitrocrossiato.
I'm giving this sodium yeah?
Ok, 1 microgrammo di
1 microgram per. Yeah?
1 microgram of what?
chilo minuto.
Ah,
Third.
okay.
Nitroprusside.
Io ho 70 e 29.
abbiamo iniziato il volo, ma abbiamo
Ragazzi, la saturazione è scomparsa, il segnale della saturazione è scomparso.
Sì, salvo
They're stopping what? The medicates? The bolts? Okay.
Non sento il pulso.
We still have the pulse. We still have the pulse.
alto.
Non ce l'ho. Però non satura più. Non ne sarà più cosciente. A 202 di frequenza vengo sempre in onda P.
He's not like that. Okay? You can tell he's resisting your
Sta
back.
resistendo
He's going like this, no?
sta forzato la respirazione, non vuole.
Okay, what would you like to give?
Facciamo una premedicazione con l'atropina per sedarlo, più la ketamina. L'atropina 0,02 mg per chilo. 6 di frequenza respiratoria.
Of what?
Atropina,
Okay.
then ketamine 1.5 mg per chilo.
Okay.
Ok? Fatto? Sì. E abbiamo somministrato i farmaci.
Ha una frequenza di respiratoria che non c'è stata 198
Okay, let's stop. We're done. I will clean this up. You can go back to the room. Thank you. We're going to do debriefing and then I'll come back to this journey.
So, what we will do, just because if we're too close to this, the sound is awful. Also, I know it's difficult, try not to talk on top of each other at the same time, because then it becomes, it's really bad. So if I understand, I'll give the stem, the introduction in Italian.
Yeah.
Okay, right. So I'll talk and get Eduardo to get that, and then you will be speaking in Italian or in English?
I would speak only in English, except some.
But see, all I was going to say is use whatever language you're most comfortable in and what you've been practicing.
Yep,
Right?
exactly.
Because honestly, even if you're doing everything in Italian, we can work with that.
Yep.
Eduardo will translate for you.
Yep.
This is about it. It's great for us to see you as a team working with the language that you are.
Yep.
All right. So what I'm going to do is give you the scenario. And then what we'll do is the clock will start and it'll be 10 minutes. Okay?
Just a question. Everything is in real time?
Exactly. So, don't expect that the bolus is in. No, you start the bolus, right? Everything should be
Real time, okay. Okay, so you can.
Which means that, sometimes maybe instead of doing this and then this, maybe you're doing this at the same time, right? It's okay. Don't plan on doing one after another. Because that's not what we do every day, right? We end up we do often several things at the same time. That's what I'm getting at. Okay. All right. I'm just going to come back here just so I can look at the monitor and look at you guys. So, in English or in Italian?
You want the introduction?
You say that in English so that we can hear, but also we'll have a translation in Italian.
So this is a 4-year-old who has, for the last 24 hours, had fever. He had a cough yesterday. And then this morning, when his mother came in to see him in his bedroom, he was having difficulty breathing. So the mother has brought him into the hospital. The main concern, she's worried about his breathing.
Okay, but so guys, we have a 4-year-old coming with difficulty breathing. If the patient is stable and conscious, we will have them sit it up, and the mom will be next to the child as much as we can. Let's evaluate the baby in the mom's arms if we can. Alright? Everyone has their own roles. Okay, the patient's here. Michaela, can we start with a quick look with the PAT? Yes. Mattia, let's put all of the parameters.
Is he conscious?
And the IV, Alice, please.
He is awake. He is confused. Eyes open, confused.
Okay. The skin is pale.
Pale.
Okay. Is he breathing with...
He has a lot of indrawing. He's breathing with difficulty.
We'll have him sit it up. Let's get some blood examples. Go to the
We pretend to sit it down.
We're going to
Pretend
pretend that he's seated. Okay? And let's also get some blood for hemoglobin if we need that. Let's go up again with the ahead with Elvis.
Airway spring and maintainable.
So he is breathing and his chest is moving. If you want more information, ask me what you're looking for.
Swollen tongue. Swollen lips. Angioedema. Nothing.
Normale.
Okay.
Something in
Secretion.
mouth.
No.
Secretions.
No.
Okay. BCD, please. Yes.
I'm sending the Excel.
Yeah. CBC, hemogas analysis, and chemical, which will be electrolytes, kidney, and hepatic.
I would mascara with
No rebreathing mass 15 liters.
The thorax is expanding normally or
Yes.
expanding symmetrically?
When you symmetrically,
Yeah.
and he has crepitations all throughout both lungs.
Okay, respiratory ratio?
The
Sì, non ci sono crediti però.
Non so.
Sì?
Let's get an
So if you time,
today, first second, and he's got, when you were checking his pulse, strong pulse, forte.
yeah.
strong and strong. Strong and strong. Okay. Blood pressure. Okay.
Blood pressure. Pressure è questa.
Adesso 30.
are preparing a bowl of acetone solution, 20 ml per kilo in 10 minutes. Let's check every 5 cc per kilo for any sense of preload fluid, overload fluid. And so that means let's check every 2.5 minutes. Please continue.
The patient is awake now.
His eyes open, scared, very scared.
Don't worry, your mom is here.
Pupils are normal.
Doing and reactive.
Okay. And then I'm going to expose the patient.
The glycemia, please, as well.
Yeah.
Temperature?
77?
70.
70. Okay.
The body temperature is
Let's look up as a paracetamol, 15 milligrams per kilo.
does the patient has
I
any sign in his body, in his skin, some urticaria?
There's no rash.
No rash and no petechia.
No.
Marezzatura? Marezzatura.
Signs of hypoperfusion.
He's pale. He looks
Just
pale.
pale.
It's okay.
Okay, let's do the sample, please. Yeah, okay. So right now we have a fluid.
Symptoms and
Okay, guys, the is not really well. Have we checked that the oxygen has elastic flow positions? We know we put something to help with this starting with Let's switch to CPAP, please.
His brother is not better. He just kept getting
We'll
worse.
call for it.
In the last
But
day,
it'll
he
be
really
about
hasn't
10
been
minutes.
much.
Okay,
I thought he was passed out.
Yeah, exactly. Let's reevaluate the in oxygen. He was hearing blackness, but was it like low?
And when I went to go check on him, he was very hot and he looked very hot. So I was really worried I thought he was
Let's also ask for a chest X-ray. Let's ask for a chest X-ray. Let's reevaluate for pain.
The airways are free and that's here.
Last night.
Just
something happened.
Big excursion.
Let's check for
everyone's sick at home, everyone had colds. He just didn't get better. Everyone else got better.
There's 1 centimeter below. 1 centimeter.
Yeah, everyone, but they're better now. He's sick.
And there is no distension.
Okay.
And if I listen to the lungs, KVP, they're all everywhere, everything. Okay. And this, if I do the percussion, this
Up to
dot
sound.
sound, the
Sounds
sound.
dull. Yeah.
I'm going to stop you for a second. Michaela, is there any secretion in the nose now? Which is something that I'm going to ask you, but still. Secretion in the nose. Okay. Yeah, let's finish the evaluation.
Yeah.
Okay.
Okay. Now the respiratory regulation is 39, so it's the same. So is there a wheezing?
No.
Not an expiratory prolonged.
No.
Okay. So circulation.
His eyes are closed.
Close. Is he conscious though?
He's not responding.
Not responding to pain, not to anything.
He's
unresponsive. The pupils, pupils.
They're doing both.
Okay, both.
No, not meiosis. No.
I need to right?
Is he unconscious?
Yes.
Okay, let's look into bag. Let's put the cannula in as well, please. Okay, let's go to the evaluation. Oh, he doesn't refuse that. Okay, let's just stick to the bagging.
Pulses are still present.
Yeah, and see if he refuses the bag, we'll go back to the normal breathing mask, alright?
Okay. And pressure.
Okay, the differential is very big, so we could be in front of a septic shock. So let's prepare ceftriaxone, 1 gram per kilo. And let's alert ICU that we may have a septic shock. And anyways, our baby has trouble breathing. And also let's call the anesthesiologist because we don't we don't have a very good oxygenation, the patient is unconscious, alright?
Le estremità sono calde o fredde?
Are the extremities cold or
It's cool.
cool? Okay, very fast parts of the shift in case of septic shock. Yeah, wait a second, let's put the catheter in. We got the in culture before. Let's also get urine culture. Yeah, let's do. Have you finished the second evaluation?
Okay, nice to meet you. Now in exposure, I think that is all the same. The exposure line. Yes, I finished.
Glycemia, was it right as well?
Before you checked, did you
The
want to
second one?
repeat it? It's the same.
The same, perfect. Okay, let's do a focus ultrasound.
Okay. So
It's broken. The machine's broken. Chest is not moving well. It's difficult to move the chest.
Let's do Mr. Sopa. Okay. Okay, and we have the ceftriaxone ready. Okay. Okay, let's administer the ceftriaxone intramuscular or intravenous endovena. Okay, let's stop the bolt for a second. Let's put the ceftriaxone IV and then let's start the bolt again.
We are attending the session.
Okay, and Mr. Sopa, we did everything.
Yes. The pressure.
Guys, it's my fault. Okay. Can we also put the cup number, please? Since we're, oh, we don't have the
Chest is still, it's not moving well. When you bag, it's very difficult to move the chest.
Okay, have you tried to increase a little bit the pressure in for the bagging?
Yes.
The valve? Okay. Can you hear the ventilation?
So
Yeah. No.
when you scoot that and you're bagging, the chest is moving badly.
Okay. So.
only on the
Is the trachea deviated? No. You can't hear? Can we also check? Yeah, can you check both lungs? Let's ask for a chest. No, I already asked for a chest X-ray, but let's them that we need that.
Okay, that's good. So you guys go back in English or in Italian? What's best? Whatever you're most comfortable with.
English is fine.
You sure? Okay, so whatever you practice in. If you practice in Italian, do it in Italian then. And Eduardo can translate. If you're happy doing it in English, that's okay too. It's up to you. Okay.
English.
Okay, great. Eduardo, you're fired. What you guys should know is that we need to stay back from the camera because otherwise the audio is bad in there. Also, if you can, try not to talk on top of each other because what happens is that basically it becomes garbled in there as well. And it's always a good idea not to talk on top of each other. What I'll do is I'll give you the scenario, and then after that the clock starts, and it's 10 minutes. Okay, you all right? Okay, have fun. All right. I'll get away from here. So it's a 4-year-old boy that is previously well, that the mother has brought him into your emergency room this morning. He had fever, has a lot of difficulty breathing. So what the mother's concern is that why is he having such difficulty breathing? He's now in your emergency room.
Is the mother in the room?
And the mother is there, yeah, there she is.
Sure. Okay, so guys, let's start the evaluation. We're gonna follow our rules. Let's put on gloves. Let's start the evaluation. How is the look?
He looks pale. He's having a lot of difficulty breathing. And his eyes are open and he's looking all around. He doesn't seem to be focusing on anyone.
Okay. What I see in his mouth?
Nothing. It looks normal.
Secretions?
No secretions.
The strenuous body?
No foreign body?
No foreign body. Okay, perfect. We can go to the B. Is Alec, is distance.
Okay, about creating a value federation.
Okay, I took the second 100%. Perfect. Let's go on with B. This saturation, we're going to correct 100% oxygen. Let's see if there's any improvement. Okay, let's go look at the monitor. Let's see if there's any improvement on this. Bilateral crackles.
Those crackles are all throughout both lungs.
Both lungs.
All throughout.
Okay. Okay.
And so this is respiratory retractions.
A lot of retractions, a lot of difficulty breathing.
Okay, and the situation now is 85.
With 100% oxygen. Okay. Okay. Let's go on with the evaluation. So we can do something. Do you think he's going to be better if he sits? Or does he feel better? Breathes better?
You can try.
You want to make him
So you lift him up. That's it. You lift him up a little bit.
Lift him up
and maybe he's easier. Maybe.
If the monitoring comes to tranquilize him.
Mother is going to come and console him.
Okay.
From distance.
Oh, the from distance. Okay.
I feel maybe we need more shock.
Premature maybe.
Where feel the pulse?
Strong and from quite.
Refuel time is
3 seconds.
3 seconds. Blood pressure.
So the blood pressure is 90 over 30.
30. Yes.
So a big differential.
Yes.
Pressure.
Peripheral pulse are strong.
Okay.
Refuel time is 3 seconds.
Okay.
Where feel the liver when
It's 1 centimeter below.
Where is the blood station?
You think it's normal?
Normal.
Can you repeat the signal?
Yes. We see refuel time 3 seconds and this very big difference mismatch between.
Okay. No preload, right?
No, 1 centimeter.
1 centimeter of preload. Okay, so we have some preload. Okay, it's covered by fragments. Okay. So let's get an IV line.
Yeah.
If we can
I
get
try to
that.
take
Okay.
Is it working? Yeah. Okay, I take some blood examination, blood gases, CBC, plasmin.
Okay.
He's still awake.
His eyes are open, but he is still confused.
Since he's not improving very much, can you call the anesthesiologist? Maybe we need an upper airway management. Okay.
I tried to put a vesicle anesthetista, anesthesiology. Is there any diuresis?
Not yet.
Not yet, okay. Okay,
No diuresis.
Okay, I must do D.
Yeah, okay. Let's go through E.
Cupids are normal or reactive and bilateral?
Do it, bilateral and reactive.
Okay. And they do, abbiamo fatto lo stick sharing. Stick sharing?
It's 7-0.
And he's still awake, okay?
Normally normal.
Okay.
Let's pass in very rapidly.
Do we see any rash on the skin?
No.
Not any rash. Okay. Let me check behind.
Normal.
Normal.
Okay. Temperature is high. Okay, so guys, let's make a recap and tell me what you think of it. So we have a 4-year-old that's desaturating even with 100% oxygen, bilateral crackles, and maybe a sign of preload due to the liver. So we have an IV line. What do you think? He's not hypotensive, but he has a refill time, a little bit confused. He's confused. So maybe let's go with a cautious bolus. Okay. It's 5 ml kilo.
5 ml kilo. Okay. Do we have a weight?
20.
Yeah. Okay. I go for 100 milliliter of regular. Okay. 10 minutes. Okay. I prepare the
Okay.
I started around like right now, okay? Can I suggest, I don't like the saturation.
Yeah.
Okay.
So, do you think we can ventilate with support with a positive pressure ventilation?
Do we have blood gases?
Yeah.
And also, I think it's really important to monitor blood pressure like every minute or every
Okay, let's ventilate him. Do we have an echo? A possibility of doing echo? Ultrasound? No. Okay.
Not in the next 5 minutes.
So we are supporting the ventilation also. We have an area, guys. Watch it with me. It's 7.1. CO2 is high, so it's respiratory acidosis. PO2 it's venous, so it's normal, and bicarbonates are low, and base excesses.
I restarted the ratio.
Yeah. Okay, so
there are any suppressions in the mouth? No. No suppressions.
So we have severe respiratory distress, and the main cause is probably respiratory. I think we have some liver. So let's double check. Yeah, so we have a shot that's probably mixed cardiogenic. Still, one thing, the pressure is there's a mismatch, so it's still a big shock also, maybe we have to think of that. So, okay, we're supporting ventilation and the saturation is still low, anesthesiologist is coming. Okay, so main priorities, guys, support ventilation, we're doing the bolus. Maybe prepare,
adrenaline,
yeah, push those.
Adrenaline, push those.
Okay. Chest is not moving. It's difficult to.
Let's reevaluate.
Is he awake?
No.
If I hold him? If I
move so that.
Let's move that.
Can we try to put it again?
Try.
Okay, guys, we're going towards worsening, stabilization. It's not tolerating gas.
Okay, here I have adrenaline 1 to 100,000.
Okay, let's get also cold dose.
Okay, here I label that, okay, with push dose.
Okay.
And I prefer also cold dose.
Okay.
We can take another.
No, you don't have that. I'll tell you, if you, right now you're free, and you speak with the mother, ask her, and just we'll check the monitor.
Okay, here I have cold dose. I'm closer to the patient. And there is cold dose. 10,000. And here is the push dose. I label the push dose. Can you repeat the treatments are not? Nel caso per i farmaci in generale per la patologia?
Both? Both reactive.
Both reactive.
No meiosis, no mid-reactive. They're fine.
2 millimeters.
2 millimeters.
2 millimeters.
Very thin.
Okay. We will check with the mother. There's maybe a story about intoxication. Okay. So we're going to think about the sample, and as soon as he comes back, we'll speak with the poison center.
Chest is not.
Do you have enough communication right now between the members? I think patients that
You're bringing it.
Ventilation. Simone, you're ventilating. Chico Maso, give him a feedback about ventilation, please. Okay. Do you think of
Lots of crepitations on both sides. Not much air entry to the chest.
If I put together, I continue with the C, okay?
Yeah, let's recheck the blood pressure, please, and see if the pulse is giving anything.
Okay, we check the blood pressure. Pulse or not?
Guardi sul monitor,
Yes.
dici attivo.
Refiltare still sapere se è paracetamolo. Il bambino sanno, diventa tagliare del pasto, la famiglia è stata male, a un certo punto sono tutti guariti e lui dice no, continua a mangiare.
So every familiar is having fever.
Sì.
Okay.
Do we have echo right now? No, not.
Broken.
Any lab examination?
Just
Okay. Let's feel the liver.
1 centimeter.
Okay, nodular distension.
Okay. see you there. How do I stop Francesco?
Runs in from across the street. There's a field across the street with his son saying he's not responsive.
Ok, allora ragazzi, mettiamoci qualche mascherina. Quanti anni ha? How many years?
7.
Ok, grazie. Quindi Raffa prende le citazioni, poi subito il corso. Mettiamo subito i parametri.
Is he rated? But I didn't see it.
Non c'è corso? Ok.
Whatever you feel on the mannequin is real.
Ok. So iniziamo la costruzione, incidere vedere, monitor, centrifuge e farci. Ok, prendiamo l'accesso venoso e metti l'ossigeno in maschera e ventilalo. Fine secondo. E fine primo ciclo, per favore.
I'm trying an intraosseous line. With access seeker. Ok.
Uno. Ok. Fine secondo ciclo.
Abbiamo una.
Fine terzo ciclo. Ok. Brava. Stacchi le braccia. Usiamo il grossa, prepara il spaziale di adrenalina. 0,1 mg per chilo, 0,1 ml. Abbiamo il primo tracciato delle ECG, sembra una fibrillazione ventricolare. Ok, va bene. Allora, fibrillazione ventricolare, ragazze, controlliamo il polso, ritmo defibrillabile. Ok, Lucia, carica per favore a 2 giorni chilo, 25 kg stimati, carica 50 kg. Ok, sta caricando a 50 gradi. Ok, ragazzi, sta caricando. Ok, defibrillatore carico, via io, via voi, via Gusta. Posto l'ossigeno. Nessuno tocchi il paziente, scarico. Ok, vai. Quindi prima scarica e cominciamo a riprendiamo la regia al disco e sinistra, la prima dose di adrenalina.
Ok.
Ok, e
I'm going to do a 2.5 milliliters of adrenaline at the preparation of 1 to 10,000. Okay? Pulse.
fine secondo ciclo. Ok. Gita, preparazione per una media alternativa, per favore. Giulia, intanto prepara un'altra adrenalina. Fine quarto. E la megalone 5 mg per chilo e per una seconda intraossa. Ok. Abbiamo il papà già, per favore, puoi andare a chiedere il papà. Maschera alla regia posizionata. Andiamo in maniera sincrona. Ok. Gita, per favore, metti il taglio di 2 quando riesci, perché in più di fare l'incasso della taglia.
I'm going to try for another intraosseous. We access seeker. Okay.
Posizione del tiger C2. Abbiamo messo il tiger C2. Ok, a che punto siamo nella siamo a un minuto. Quando vuoi. A un minuto, ok. Abbiamo il metronomo, quindi abbiamo le la via io, bravissima, grazie.
E le faccio un po' anche 2 via adesso.
Sì, ok.
2 accessi.
Temperatura 37, ok? E quindi l'agricoltura e del sangue, per fare il crociate, mi sembra che mancano 15 secondi.
Okay. I'm going to draw for renal gas analysis, blood count, and biochemistry, general
È una persona che sta giocando a calcio, gli è dato una pallonata nel petto ed è caduta a terra. Ok, allora abbiamo una notte di dati,
non ho ancora nessun
golo. Anzi no, prima di portare il golo ho preso analisi del ritmo, ok, sono ritmo di scrillare bisogna per incorporare. Avvicina se abbiamo a disposizione le cose perché ha preso una pallonata sul braccio. Se stai lavorando faccio la seconda scarica. Sì, carica intanto non abbiamo il cover. Ok, ragazzi, allontaniamoci, io proprio da tutti, faccio la seconda Ok, noi abbiamo l'ecografo, va bene? Andiamo avanti, quindi era anche più. Ok, sì, va bene. Possiamo chiamare per favore il radiologo e chiedere se può venire con l'ecografo a valutare se c'è una. Per fare una radiografia del torace, per portare questa cardiomegalia, necessità di cambiamento cardiaco, che è portato dal. Il radiologo e avvisa anche il cardiologo e avvisa il rianimatore.
Allora io farei la migliore
Sì, somministra il migliore e 5 mg al chilo. 125, vai.
I'm doing 125 milligrams of
Abbiamo il
is 5 milligrams.
Ok, va bene. Allora, quanto è passato dalla prima seconda adrenalina? Se 0,1 mg. Quanto è passato dalla prima adrenalina? Ok. Sì, dobbiamo somministrare il 35 minuti, quindi secondo me sono per somministrati. Sta passando. Ok, va bene, sta prendendo nel timer, ok? Preparati per favore per una dei vicenti, nel senso che ragazzi sarete più organizzati, ok? Ok. Preparati intanto per una cardiotecnica vicenti, non voglio preparare. Ok, ok, perfetto. Giorgio, gli avvisi l'animatore, dici che abbiamo rianimato un bambino per questo momento è ROSC, dopo 90 minuti di rianimazione, 6 minuti. Abbiamo fatto 2 scarichi perché si è stata una fibrillazione ventricolare, una data di adrenalina, una data di adrenalina, abbiamo degli esami in corso, il sospetto è un tamponamento cardiaco secondario a trauma e abbiamo fatto una radiografia del torace. Per favore, allora, abbiamo già fatto lega, quindi ok, grazie.
Abbiamo fatto.
Okay, perfect. I'm Tommaso, the team leader, and Marco as timekeeper, and Vanessa to the drugs, Benedetta doing the evaluation, Chiara to the monitor, and Elisabetta to the airways. I take a quick look. Is he irresponsive or totally unresponsive? Completely unresponsive. Okay, can you, Benedetta, puoi prendere un polso? 8?
There's no pulse. He's 7.
7 years old? Non c'è polso? Breathing? No breathing? Ok, perfetto. Ragazzi, cominciamo con il massaggio. Chiara ti chiede di mettere le placche per fare l'analisi del ritmo il prima possibile. Perfetto, buono il massaggio. Ok. Mettiamo un accesso venous axis.
No.
No?
And then you should take hemoglobin, funzione dell'autorenale, la sfenosa,
avvisami appena abbiamo le placche. Ok, fermo il massaggio, analisi del ritmo. Ok, torniamo. Allora, abbiamo una fibrillazione ventricolare. Abbiamo ventricular fibrillation, so we enter the algorithm of the arresto defibrillabile. Ok? Carichi a 2. Do we know the weight of the child? Ok, prossimiamo, cominciamo a 2 gradi.
What weight are you using? What weight did you decide?
Che peso viene deciso Chiara? 20-25. 25 kg. Ok? Defibrilliamo.
Ok, io abbiamo i tutti, scarico.
Fallo là. Ok, did it work?
Ok, make the noise. Carico.
Fai la carica. Sento, fai la carica perché we can hear.
Yeah, now it's charging. It's charging now.
Okay.
Now,
So we do not consider the first one, right? No, fai questa perché la prima non è andata. Scarica.
Scarico. Ok, arrivo, mi voglio tutti, scarico.
Ok?
Carico.
Marco, 2 minuti da ora, mi fai. Aspetta, facciamo 2 minuti per la rivalutazione. Nel frattempo facciamo per raccogliere un po' di analisi.
Prendo la pressione, ma voi Pressione manuale?
No, perché non è Italia.
Pressione manuale? La pressione, la prendo manualmente.
Can we handcuff the pressure because it's not coming out there? We do not have any pressure. Do the pressure manually.
Do you have blood pressure in pregnant breath?
No.
Okay.
There's nothing.
We started the bonus. I asked Vanessa to
Preparata l'adrenalina?
Ok.
3 minuti. Da un minuto la valutazione,
Controllate la ventilazione?
Sì. Per il prossimo episodio magari tu prepari una maschera laringea. We prepare a laryngeal mask for the next presentation. Sì. Do we see something with undressing? Do we see something like bruises or nothing else? Okay, secondo che abbiamo questo bambino incosciente, 7 anni, 25 kg, fibrillazione ventricolare, è incosciente per fatto un'analisi del ritmo. Abbiamo fatto la prima scarica a 2 giorni per chilo, tra 15 secondi gli esami sono già in corso e abbiamo il volo che sta scendendo. Questo ciclo di valutazione, ragazzi, a ritmo. Controllami comunque il polso, per favore. Vediamo per essere certi. Ok, prendiamo il massaggio, chiaro che massaggio. Perfetto, Benedetta vai al monitor.
Allora, è una possibile commozione vortice, stavo giocando a calcio, devo andare a guardare sul torace e non è cardiopatico, ma
Perfetto, go with adrenaline.
ho un rubinetto 3 vie, chiudo il volo, metto do 2,5 ml di adrenalina tirata 1 a 10.000 con un flash fisiologico.
The defibrillators making noise. I don't think it received the last shock.
Did not receive the shock?
Because it sound.
Yeah, sorry, try again.
Okay. Now it's still
Okay. Ok, mi chiami l'anestesista per favore e vediamo se cardiologo.
I call for anesthesia. Con un tossicologico, faccio partire da
Toxins are
Ok, ritmo organizzato,
ritmo organizzato, polso?
No, segno europea.
Si può rivedere il polso? There is pulse. There is a pulse, okay. So restart the evaluation, we start from A, okay, for Ross. Cominciamo dall'alto e Ross.
Sì. Già ha una maschera da laringea che tollera.
Does he keep the laryngeal mask or he spit it out?
He keeps it. You guys are done. It's finished.
Okay.
All done. Okay. We'll meet you in the debrief room.
Okay.
Alright. Have fun. Thank you. Have fun. Okay.
Don't be nervous. No.
That's right. Nothing. Good.
I'm nervous.
No, you shouldn't be nervous. Okay. This, and now, so we're going to, first question is going to be, when it comes to language, are you most comfortable as a team talking in Italian?
No, English.
You sure? Yes. Okay, all right. So, what we're going to do as long as you stay where you are and don't come any closer. Coming closer, the audio on this gets worse. So try not to talk on top of each other. If you kind of talk quietly, it's one after each other as opposed to everyone talking at the same time, because that also confuses the microphone too. Okay, so what I would also remind you to do, make sure that if you're doing something, if you're going to call for an X-ray, you're going to call a cardiologist, make sure you yell it in the direction of Eduardo and I, so that we can actually hear it. That way we know that you've done something. Otherwise, we have no idea what you're doing. Okay? So I'll give you the, if you want it, if you're okay, I'll give you this scenario in English. If at any time you want to flip back into Italian, that's okay. There's no, you don't lose points for that. And then once I've given you the scenario, it starts and it's 10 minutes. Okay? All right. Okay. So this is a 4-year-old boy who has cystic fibrosis, very bad cystic fibrosis. He's had multiple pneumonias every year. He developed a pneumonia at home 2 days ago. He was started on antibiotics by mouth, but this morning, the mother, who's the mother? the mother, she's brought him in because she's really worried about, he's been coughing a lot, and then today he's having difficulty breathing. Okay?
Okay.
That's the story.
So guys, tomorrow, the boy with cystic fibrosis is coming because he had another pneumonitis. So we use the airway, anesthesia, circulation, so you monitor, just medication. I'm here and the voice arrived.
Yes, sir.
Okay. What about this state of consciousness? Is awake?
His eyes are open. He's very scared,
okay.
And he's having a lot of difficulty breathing.
Okay. What about the color of the skin?
Pale.
Can we hear anything audible?
No.
Okay, so guys, let's start applying multiple monitoring to the patient in a comfort position that is in the end of the bed, and start with the evaluation and feedback. Okay. So we are raising the bed. We don't have a bed.
Okay. So you're saying head of the bed, head of the bed. Okay, that's okay. Yeah.
So we are applying for the CG.
We're breathing mask, 100%, 10 liters per minute. Okay. The highway are patent.
Excuse me?
The highway are patent.
What are you looking for?
I look in the mouth. I think that there is some secretion.
Okay, no secretion.
Okay. The tongue is big.
Normal.
No, it's normal. Okay, and there is some malformation, something
looks normal.
Okay, so they are open.
Yeah.
Okay.
Perfect. Continue with the breathing and also circulation. First pause the separation of BG because it's sleeping with the nerve breathing mask. So just think about like non-invasive continuous positive air pressure. Okay. And also we have the success, please.
Okay. Can I take a line? I succeeded in it.
Yes.
Then a line?
Yep.
Okay. So I take a line?
So we have since the tachycardia with the operation with the dose operation. I think now it's time to with the non-invasive support for the oxygen like nasal cannula. We have something for the continuous positive pressure for the CPAP.
So CPAP would take 10 minutes to get the CPAP machine.
Okay, so
you don't have CPAP right now.
Okay. Okay, we don't have CPAP, so
okay.
We don't have CPAP. Okay. So maybe also try with the back mask.
Okay, the respiratory rate is increased and the other is bilateral.
Okay.
Are these crackles?
Yes, lots of crackles on both sides.
Okay.
He pushes the mask away.
Pushes
the mask away.
We got the mouth. We go to mom to stay close to him so he can feel more comfortable. We also perform a blood gas analysis.
And blood test.
And also with circulation.
The central pulse is present.
I want to see the blood pressure again.
The recording is regular.
Still has fever.
Okay. Are there reticular signs, jugular distension, hepatomegaly?
His liver is 1 centimeter down, and his tubular veins are normal.
Okay, thank you. Are the people reactive to light?
Yeah,
Okay.
2 millimeters.
Are there any neurological signs? Can you move all the extremities? Fine, okay. Capillary glycemia?
It's 2 seconds.
Okay.
Okay.
Capillary refill is 2 seconds.
Okay, capillary glycemia. Capillary glycemia.
Oh, hyperglycemia. I'm sorry. 70. 70. For sure.
Okay, if you analyze the patient, can we see anything? Like any urticaria, any predicate?
No, skin is normal.
Okay, so guys, we are patient with fever. Now we're waiting for the sample. Antibiotics that we have maybe like Hyperagina Tazobactam, maybe better, and also Toloricina. So, what about the sample?
This is going with cystic and he take medication for pneumonia 2 years ago from school. He takes salbutamol and ipapropyl for cystic anemia.
Okay.
And last paracetamol is about last night.
Okay, perfect. So,
I can administer paracetamol.
exactly. Also,
For the
we call
fever?
the radiologist for an X-ray.
Yeah.
And we for such a
How does it weigh? How does it weigh?
20 kilograms.
Okay. We also.
He is unconscious now.
Okay, what about the central pulse?
Yes, there is a strong pulse here.
Okay, we also call the intensive care unit for the possibility to sedate the patient and also to intubate the patient.
Iniziamo la maturazione assistita. Inseriscono la
Okay, so the patient now is not conscious anymore, so we are supporting with the back mask.
I administer paracetamol 20 mg per kilos and piperacillina 100 mg.
Okay. Do we have the blood gas analysis? Okay, thank you.
I've told them.
Can someone check if there is symmetry and penetration there in the thorax? The right side is fluid.
Okay. So we work on thorax.
Yes.
Okay. Prepare to drain the pneumothorax.
Yes. Okay.
Do we have like?
I will take a needle of big diameter, 18-20 gauge.
And we can press the pneumothorax at the second intercostal space and with the clavicular line. Okay.
Okay.
How are you just putting the needle in, or what are you doing? Tell me what you're doing.
Okay, I'm just checking the second intercostal line.
Yeah.
And yes.
We can use a system.
You put the needle in. Yeah. Okay. Nothing's.
No, we can use a balance system.
What? You just tell me what you want to do.
Okay.
Yes.
Okay, we can use also necessary to remove
Yes.
the
expression.
Exactly.
Air
Okay.
We also call the thorax surgery for the possibility to have thorax drainage. Okay, the pressure is going down. Check always the central pulse because the patient is unconscious. Central pulse is present. Okay, also I want to check the circulation about the. Now there is.
Okay.
Great improvement.
The saturation.
Is it moving at
You can hear a little more on the right-hand side, but it's very different, left compared to right. It's still very different.
Can we perform an echo pass?
It'll be 5 minutes.
Okay, so we will check. Okay, so keep supporting the patients in the airway. Okay, so the air was totally all down, right? The patient is still unconscious?
Yep.
Okay, so we keep supporting the patients with the big mask. The patient, yes,
I will start with the radiation.
Yes.
Okay.
Is it improving? Now the RF is much better in the right one.
I will start with 200 milliliter of sodium chloride. Can I take
what? Excuse me?
20 milliliter for each fluid?
Oh, a fluid, okay.
Can I take another line? Can I succeed
Sure,
to take another line to speak? Okay, so I will take another line.
Okay, so guys, now the patient has fibrosis, probably pneumonia, complicated by pneumothorax. We need the pneumothorax. Now he's employed a medication. Also, now the patient has low blood pressure, so we are supporting him with the fluid. Alessia, please check me the circulation status, like peripheral pulse and patient time. Okay.
So this week. Forte.
Week. Okay.
Okay, so we are performing the fluid. What about the temperature of the extremities?
Are the extremities a little bit cold or warm?
Cool.
Cool. Okay. Okay.
Cold.
And refill time is
3.
3. Okay.
Okay, extremities are full, so we have substitution. We also have called the radiology. I don't know if we can perform the X-ray or we have to wait.
It'll be 5 minutes. So that's it. Also, try not to talk on top of each other. Not just because it's bad to talk on top of each other, but also because it makes it really difficult for the microphone. And it's all about the microphone. That's the most important thing. What I'm going to do is I'm going to give you the scenario, and then when I finish, the clock starts, and it's 10 minutes. Okay? Questions at all? No. All right. Have fun. Okay. This is a 4-year-old boy who has very bad cystic fibrosis. He has had multiple hospitalizations for pneumonia, severe pneumonia. He developed a pneumonia at home 2 days ago, and his doctor started him on medicine, antibiotics by mouth. But this morning, he is having a lot of difficulty breathing, so his mother has brought him into your emergency room, where you are all working. Okay?
Okay.
Go for it.
Okay, so guys, we have this 4-year-old boy with cystic fibrosis and a history of multiple hospitalizations. He has already pneumonia and he started the antibiotic therapy 2 days ago, but today he was in respiratory distress, so it's coming. So Emilia will take care about medications, Julia will check the breathing, Julia will check the airways, Gabri will take care about monitor, Angie will be the timekeeper, and I will be the leader. So let's protect ourselves and we start. Guys, it's 15 kilos for the weight. Okay. Hello, how are you? How do you feel? Can you hear me? He's conscious.
Eyes are open, he looks very scared.
Okay.
So he is conscious, yes.
Okay, what about the skin color and the breath? It's already the non-breathing mask, one is the same concentration of oxygen, 10 km per minute.
Yes.
Okay? So let's place the... Yeah, and also the cardio monitor, please.
Yes.
And I try to take time.
Okay.
Yes.
The airways are clean.
What are you looking for? What do you
Secretion, something?
secretions?
No. Okay. And he's conscious now.
He is conscious.
Okay. He took the mask on his face.
Yeah. So the mask, he is tolerating. Yes,
Okay.
it's okay.
Okay, so let's check the respiratory rate.
Now
It's
40.
Okay.
Can I see any
retraction for nasal flaring, chest rise?
Yes.
Okay, let's proceed with listening. saturation is not that good.
The saturation is right, it's 83 on 100% of oxygen.
Okay, guys, take listen.
Allora, oxygen.
Okay, then, which is the oxygen saturation?
81.
Okay, so 81. Okay, what about
Yes, we change with a black mask.
in support mitigation, yeah. Okay, yes, so we can also ask for
He
CPAP.
starts crying.
No, he doesn't want. Okay, let's ask for CPAP, and in the meanwhile, we support him.
In the meanwhile,
CPAP is going to be, it will be 10 minutes. They have
10 minutes. Okay.
Now we put the eye flow with the nasal cannula with the 100% of oxygen and
How many liters? How many liters per minute?
2 liters per kilo.
Okay.
So it's the 30 liters per minute.
Okay, guys. So did we finish the check of the breathing?
Yeah.
Okay, let's continue with the circulation. In the meanwhile, I called the anesthetist because I don't like the breathing. Okay, maybe he needs the endotracheal intubation.
I prepared the tube.
Yes, you can talk with the mom. Okay, in the meanwhile.
Finish the
Yeah, I finished. You can check with the mom.
Okay,
Yeah.
start circulation.
Did I manage to get the line?
Yes.
Fever. Okay, so I would suggest to start with some blood gas analysis, cultures, and also blood gas analysis. Blood gas analysis and cultures.
Okay. Center pulse is present, also the radial is present as well.
Okay.
Heart rate is 150.
Okay.
Okay. I'm checking the pressure. Yes.
I don't think he's really gotten any better. And then
I just
the fever I give it
Yes.
I didn't give it to him this morning. I just brought it.
And what about the capillary field?
Yeah. And then
Just second, okay.
regular
So
medicine,
it's good.
he does.
And what about the temperature and the color of the limbs?
Yeah,
Pale.
like for his sleep
And cool.
Okay.
But it's not really working.
And what about signs of preload? So what are the general lights? Can I palpate the matter?
You can't see his jugular veins, so I don't know. His liver is 1 centimeter below.
Okay.
It's also affected by. I start to prepare the African fever meanwhile. Yes.
Okay.
We are preparing.
So the pressure is 70, 40.
Okay, guys. So the pressure is low, but yeah, he has no signs of overload. Maybe the hepatomegaly is due to his disease. Okay. So maybe I would support him with the fluids.
Yes.
Maybe we stay a little bit low. So an update.
Eyes closed.
Okay. Okay. I called the anesthetist. So I started the bolus before the experimental. Yeah. I called the anesthetist. Are you the anesthetist?
She'll call you right?
Oh,
So you received your page contact.
okay.
And I started.
Okay, so now I'm starting the bolus of 5 ml per kilo of mineral feed, that is 75 ml, in 10 minutes. And meanwhile, maybe I try to do another line. Yeah.
The chest is not moving.
It's not moving.
Not moving.
Not moving.
Okay.
Both.
That's hard. The chest, when you're moving, you can't see any of the chest move.
Okay. So we prepare for intubation, we put anesthesia, and we put a laryngeal mask.
Yes,
Right.
let's put the laryngeal mask. Okay. You're ready to get into the therapy? Yes. Okay. Which type of antibiotics? Okay. Let's ask also for a chest X-ray that side. Okay.
Okay, so
Now I see the thorax that expand symmetrically.
Nope.
No, still we tried before.
You want to listen again?
But here, we got it. Already listened.
We listen different type of murmur. We listen the murmur.
Neither chest is moving well. Neither side is moving well.
But it's correct positioned the supraglottic device, the laryngeal mask.
Maybe we can
You
put
tell me.
the entire.
Let's put the entire.
Yes.
Okay, I can hear the definition better on this side, on the
Okay,
left side.
the
While here,
35.
I can listen just on the upper part of the lung here.
Sorry?
So,
I can listen better here on the left side of the patient, while here it's just concerned on the upper side of the lung. While the thesis is a little bit.
okay, it's good. So, yes.
Maybe we can try to take him some salbutamol nebulized.
Yes.
Just to and maybe with the bromo.
Okay, bromide. Yes. Yeah. Okay, let's do this. Okay, I can try to call again the anesthetist because maybe it needs endotracheal intubation.
We prepare already the tube, and there is ammo, there is oxygen, so there is also oxygen, and the lane down.
Okay,
I
prepare the
entire
solution.
is right, it's 36
I prepared the solution with 50 micrograms of ipratropic bromure with 150 micrograms per kilo of salbutamol.
Yeah.
And so it's nebulized now with 2-3 ml of physiological solution.
Okay. Can I listen again?
Yeah.
I think it's bilateral, so I don't think it's a pneumothorax.
No,
so
it's not.
let's have a recap. This guy has cystic fibrosis. He had pneumonia since 2 days. He's already in antibiotic therapy, but now he has respiratory distress. But now he progressed to respiratory failure. We already put the laryngeal mask. So what? We are ventilating him. Okay, so we should think about other possible causes. Let's start again the reassessment. Okay.
Yes.
So let's check again.
So the airways are clear, there is no secretion, air patent with the laryngeal mask.
Air is going in and out of the laryngeal mask. Yes.
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 Okay.
Okay, let's
Yeah,
check
the
again.
respiratory
rate. Okay, she's been taken, so.
But the saturation is
the saturation is still
How many minutes
75.
since the bonus? I was talking first in the respiratory rate on the saturation.
Almost 5 minutes.
Okay, so we check also for overload sign. The listening is still the same, it's like
Still the same.
Yeah, okay.
While the saturation is still
75. Retraction, something have changed during this time? Or?
He's not trying to breathe anymore. Okay, good. What's best for you? What have you been practicing in?
Italian.
Do it in Italian, and Eduardo will be whispering in my ear, constantly translating. Okay. So what I would do, Maria. Right, Maria. Just move a little bit further that way, because what happens is, if you're too close, this gets garbled. Try and talk not one on top of each other, right? Try and talk one after another, because otherwise also all the sound gets garbled next door.
Non parlate una solo l'altro, sempre per fare
I will give you the, so for the, if you're going to call for an x-ray, call for cardiology, make sure you yell it to us so that we hear, right? You know, we can only write it down if you tell us that you're doing that. Okay. Understand? And then the last point, I will give you the scenario. Eduardo will translate to make sure that everyone's happy, and then the scenario starts, and it's 10 minutes. Okay?
Okay.
Swami?
Okay.
All right. Okay, you ready?
Yeah.
So, This is a 4-year-old boy with cystic fibrosis.
Con 4 anni con fibrosi cistica.
He has very, very bad lung disease.
Ha una malattia polmone molto grave.
He's had multiple admissions to hospital each year for the last 2
Ha avuto
years.
molte entrate nell'ospedale negli ultimi anni.
He developed a pneumonia 2 days ago.
Ha sviluppato polmonite 2 giorni fa.
And his doctors started him on oral antibiotics.
È iniziato l'antibiotico perviolare.
This morning, his mother found him having a lot of difficulty breathing.
Stamattina aveva difficoltà nella respirazione.
So she brought him into your hospital emergency room where all of you are working today. Go.
Bene ragazzi, mettiamoci la mascherina e i guanti, paziente stimano un peso di 15 kg, è arrivato e iniziamo a fare la rotazione iniziale, respira, è cosciente.
His eyes are open, he is very scared, he is awake and very scared.
Ok, la mamma è presente, può... Va bene, è pallido,
He is pale, pallido, and he is having a lot of difficulty breathing.
ok? Allora ragazzi possiamo metterlo in una posizione di comfort, bravissimi, mettiamo i parametri, possiamo già mettergli l'ossigeno con l'aria reservoir. Sì, benissimo. Ok, prendiamo la temperatura,
82 di saturazione e 38,5 di temperatura.
va bene? Nel frattempo può iniziare con la valutazione delle vie aeree, basta che siamo fermi.
Come sono le vie aeree? Ci sono secrezioni?
No secretions.
Come respira?
Air is going in and out, and his chest is moving.
Faccio un tentativo della
percussion device, and then he's on some extra formula because it's hard
faccio l'esame faccio indici di flosi e elettroliti e soprattutto a sinistra, i laterali quindi
Vuoi che valuto la C?
la C, la C,
Sì, anche qua, il refil capillare? Non si ci sono il refil capillare?
Il capillare.
È ancora pallido o è anche marizzato cianotico?
No, pallido.
Le estremità sono fredde e calde. Ok. Ci sono segni di precarico?
What signs? Liver is 1 centimeter.
Se c'è epatometalia, ok, 1 centimetro, ok? E se c'è fulgore giugulare?
So, jugulars are okay, liver is 1 centimeter.
Ok, sentiamo i toni cardiaci. I toni cardiaci, abbiamo la glicemia 60 di pressione.
Heart sounds normal.
90 su 60 della sotto.
Io ho fatto, scusate, abbiamo la glicemia?
VTX, glycemics.
70.
Inizia a preparare preparati sul volo di cui potremo avere bisogno di soluzione fisiologica. Preparati anche voi una paracetamolo, così possiamo interpretare i parametri. Ok, tu Alex avevi qualcosa?
Ma ci sono molto ieri, oggi peggio del solito, quando si trova Pomeriggio, però questa volta non si preoccupa perché è molto peggio vedere un po' le date questa mattina.
Ok, ti ha detto che antibiotico ha fatto?
Argomenti?
Ha qualche allergia?
No, nessuna allergia.
Ok, va bene.
Abbiamo sempre l'80 di saturazione con 100% di ossigeno.
Ok, allora possiamo
vogliamo sostenere
la saturazione sta prendendo, possiamo sempre vigile, sempre cosciente.
No, eyes are closed.
Ok, poi iniziare l'ossigeno con la maschera, sempre con l'ossigeno al 100%. Ok, possiamo chiedere l'anestesista che chiama il radiologo per la torace.
Sì, dove
ragazzi dovrebbe essere anche taticarico per la terapia che ha fatto. Vediamo come si migliora con la respirazione. Intanto che qua ci facciamo il paracetamolo 15 mg al chilo, 5 grammi, faccio il paracetamolo, basta.
Abbiamo 74 di saturazione.
Abbiamo degli esami? Electrolyte, emogas.
Ok, sono questi.
Perché qua c'è respiratoria, con segni di shock, con ciclo dilattato, so che puoi fare un coro fisiologica,
che non si è trasmessa
10, questo campo di fegato, 10 mg ml chilo, 10 mg, ok? Inizia a fare 150,
sembra che non ci siamo pure nel polmone destro.
ok? È arrivato il radiologo.
Do we have the radiologist? 5 minutes, ok.
Espandere a destra.
Non sta migliorando la saturazione.
Siamo possiamo fare un eco.
No.
No.
Do we have the electrolytes?
Sì. La maschera.
Maschera, posizione.
Sì. Vedete se non si prende, non ci sono secrezioni.
No secretion.
La bocca è aperta, però scusa. La posizione giusta. No,
Sì,
prova a chiudere la valvola.
Non penso che
Abbiamo sempre una saturazione del 74%.
E abbiamo parlato anche per delle culture?
Sì, già.
Ok.
Nel frattempo poi fare la cosa
Sì, facciamo intanto.
e ridotto a destra che potrebbe essere compatibile con una so che se nel frattempo puoi iniziare a fare l'antibiotico con ceftriaxone 100 mg al chilo, ok?
150.
150 va bene? Mi pare per la pressione. Faccio ok, parlo la pressione periosa, verso l'antibiotico. L'anestesista sta arrivando. Vogliamo fare rivalutiamo anche lo stimolo doloroso. Può scegliere rispondere allo stimolo allora, verbale. Allora,
Abbiamo 70 su 49 ipoteso.
Vuoi controllare il polso?
Sì, sentiamo sempre i polsi.
Vuoi aiutarmi?
L'assistente.
Ecco, non c'è il mio. No, sì, lo sento. Non ci siamo
Vogliamo parlare un po'?
Non c'è più centrale.
Non c'è
check the central.
Guardiamo bene.
Circolo.
C'è polso? Se non c'è polso, ragazzi, no,
There's no pulse.
Sì, c'è polso, ok? Polso. Ok, possiamo fare. La tachipirina l'abbiamo fatta. Allora abbiamo la avanzata, il radiologo.
Dovrebbe arrivare, sta pure.
Ok, la pressione è ancora bassa. Se abbiamo finito il primo volo fisiologica, ok, possiamo fare un altro microvolo da 5 ml chilo in 10 minuti.
Ok.